Hey guys, this is Dr. Zannis, and I'm happy to share with you this video that my staff was kind enough to put together for you about JP drain care. This is a question that we frequently get after a tummy tuck, as mostly only tummy tuck patients are the ones who have drains. And the purpose of this JP drain is to collect the serous fluid that your body naturally makes after a surgery like this. What you see is that it's kind of reddish because it's tinged with some blood, and so it's called serosanguinous fluid. And here my nurse is grabbing the tube firmly between her index finger and thumb at the site of the insertion, and then pulling using a gauze or something moist in the other hand. So what you want to do is not let go of your left hand, as in this case, because the whole tube could rip out. And although it is sutured in place, a very hard yank could take it out, and it would be painful, and then it would not be doing its job anymore. But stripping the drain is what we call it. Grip it firmly, pull with the other hand, and strip so that there is some vacuum created, and any clots or gunk that's in the tubing will be freed and allow it to function more effectively. Because what we want is to not block the opening of the tube, but allow all of that stuff to drain into the bulb.
A few moments later.
It should turn from a pink to a light pink to a nearly clear color by the time we remove it. Along the way, you will need to empty the drainage. Before you do so, you unscrew the cap. You'll see that it has filled out and is a full hand grenade shaped bulb. Then you empty it into the measuring cup that we provide and record the amount of fluid that is in there. We will have a document to record that on. Then you push the bottom of the bulb all the way up, and while you're doing that, you re-secure the cap by screwing it down, and now it has a vacuum seal and suction has been regained. Give us a call if you need any help with this. We're always on standby to give you a hand. Thanks a lot, and see you soon.